All right. Welcome to Chapter 1, SED 409, Descriptions, Definitions, Characteristics, and Potential of Moderate Severe Students. What I want to talk about is we're going to define severe disabilities, but in your chapter you're going to read about the general learning disabilities and abilities, personal skills, social skills, sensory development, and physical development. Those are the key areas in which we define severe disabilities. So you're going to read all about how those affect a student with severe disabilities. So I'm not going to go into those. And we're going to talk about the ability for those to demonstrate and maintain independence, because independence is our key goal for working with students with disabilities. And the traditional categories, we're looking at moderate, severe, profound, intellectual disabilities. Autism is a part of the mod severe disability category, and multiple disabilities. In the definitions, this is where I want to talk about TASH, which stands for the Association for Persons with Severe Handicaps. This is how we got TASH, the Association for Persons with Severe Handicaps. So that's where TASH comes from. So TASH talks about severe disabilities, and they're talking about providing ongoing support. And with students with disabilities, they definitely need ongoing support. When we talk about students with mod severe disabilities, if you think about providing them with independence, they're going to need ongoing support because of the moderate severe disabilities that they have. Ongoing support, when you think about what's going to be needing ongoing, we're talking about major life activities. So when you think about major life activities, what are you thinking about with major life activities? Things that they need to be independent. So life activities include employment, independence, so that's talking about self-help, and things they need to help take care of themselves. So when you think about taking care of yourself, and when you take care of yourself, that all includes feeding and caring for yourself, hygiene, clothing yourself. All of those independent things, your mobility, your communication skills. If you can't communicate your wants and your needs, how do you tell somebody what you want, what you need? You're meeting your basic needs. So how do you get those basic needs met? These are all things that you have to think about with what you need, and how would you get a person with severe or mod severe handicaps to get them to meet these needs towards independence. We all want to be independent. That is our major life goal. And in order for people with mod severe handicap conditions to have these met, somebody has to support them. And it's difficult for people to have these needs met if they can't communicate them, if they have difficulty moving around in order to meet them, and meeting employment skills. How do you meet those employment skills if you can't get there to meet them, if you can't get dressed to meet them, if you can't get up and feed yourself and clean yourself to get there? So everybody deserves to be able to do that. How about living independently? You want to live by yourself. You want to learn to live by yourself. These are parts of being able to be independent. So, all right, let me clean this off. Oh. Maybe I wasn't supposed to use water. Learning to use the light board. So think about working with a student with mod severe disabilities and the movements that's required in helping them move from one activity to another. As a teacher, would you be able to do this by yourself? If they're little, you can move a little child, but think as they grow and you are moving a large child from one activity to another, how difficult is it? Transition is difficult. So when I was teaching my multi-handicap class, moving students from one activity to another was difficult. I needed my paraprofessionals. So moving a large child required 2 people. So think about when you are working with students with mod severe activities and how much you need your paraprofessional. So just want to plant that seed real quick. We want to be self-sufficient. That is part of everyday life. Our next one is A, I, D, D. I know, especially we have a lot of letters. So, American, Association on Intellectual Developmental Disabilities. So, what this was talking about is intellectual disabilities. We no longer call them mentally retarded. We are now calling it intellectual disabilities. You know, MR has such a negative connotation, and students with intellectual disabilities, they already have such a stigma attached to them. Now, intellectual disabilities defines where they have a difficulty, and it says that they have significant limitations. The word significant gives you an idea of what is the problem. So, significant limitations and intellectual functioning and with intellectual functioning and adaptive behavior. This is what qualifies them under the severe and profound, or the mod and severe and profound area of intellectual disabilities, to qualify them in this area, other than being in the specific learning disabilities area or the EBD area. They have to have problems in cognitive functioning and adaptive behavior, but it has to be significant. What that means is that it affects their cognition, their social skills, and their adaptive skills. So they are affected with their brain functioning, their inability to understand what they're reading, what they're learning, their social skills. They don't have those abilities to be able to work with students or work with their peers and understand those social cues and be able to get along with others. They don't understand that give and take and turn taking and sharing and adapt to their behaviors, to their different environments. They don't understand that what they learn in the classroom also can be applied to other environments. So this is the big part of being able to take what's learned in the classroom, and it also applies to the grocery store and to the playground. This is one of the big areas that they don't understand, generalizing skills and transferring skills into other areas. So being able to independently take care of yourself, this is our big goal, independence. This is what we want for all of our students, but this is the big goal for our Mod Severe population. Their parents want them to be able to be independent and not always rely on them every day. So what the concepts that they have a difficult time with are numbers, reading, time, money management. All of these apply to our everyday living. This is where they have a hard time. Being able to apply that to everyday functioning in real life. If you think about the skills that we have and that we use every day with our numbers, of counting out how many times we need, how many things that we need to put on the table, how many knives and forks and plates, reading a simple recipe to know what items go into making bread or making rice casserole. Time, what time is it? Is it AM or PM? Knowing what time to get up. Money, so that we know how to count our money. And when we go to the store and we pay something and they give us the correct change back. And being able to manage our money and know that we have this much amount of money to last us for the rest of the week or the rest of the month. That's being able to function in daily living. This is what our students need to learn in order to live independently. So they have a difficult time understanding that, but that is our big goal for helping them to be able to function independently, to get out and live on their own. A lot of our Mod Severe students can't do that, and that's what we want for them. But one thing that we can do is to help them to learn that and apply those skills to living somewhat independently. We do have group homes and assisted living type homes so that they can live with a job coach to help them to learn those skills. Social skills that we need to help them to learn are learning those cues of when someone's mad, to behave in other environments. What type of behaviors do we need to learn with our environments? How do you behave in the restaurant? What do we do when we go in and sit down to eat and place our order? How do we behave there? How do we behave in a movie theater? How do we behave when we go shopping? What kind of behaviors do we need for different types of environment? So those are the things that they need to learn socially. Those are things we need to think about. And think about the practical adaptive skills. Being able to be independent, to take care of your own needs. So what does that require? Taking care of your own needs. So when you get up in the morning, do you know how to get yourself dressed? Do you know how to get ready for work? Do you know how to get to work? Those are things that require you being independent. Do you know how to pay your own bills? Think about those things that require independence. These are what our students with Mod Severe need to learn. What about if you're sick? Do you know how to call and make yourself an appointment? So, in thinking about what do our students need to learn? So, how do we teach that? It's difficult to teach in a classroom setting sometimes. You have to set up types of activities where they role play. What do you do if you're sick? How do you call? Who do you call? What about shopping trip? Think about how you can set up a grocery store setting where somebody plays the cashier. You go around and you clip coupons and you shop for different items. What about taking them to a real grocery store and letting them see what it's like to experience shopping at a real grocery store? Can that happen? It's difficult to do, but real world experiences are the best type of learning experiences for students with disabilities. They have a hard time taking what they've learned in the classroom and transferring that knowledge to a real world situation. Today, with all the technology that we have, it's good to show them videos and practice in the classroom. But a real world situation is the best type of situation for them. So, what are the levels of mod, severe, profound? I'm just going to draw our bell curve. You know, the majority of our students with SLD fall here. And here's our gifted. So what we're talking about with mod severe and profound are in this range here. You can't really see that. Anyway, So our moderate students are between 35 and 40 IQ up to 50 to 55 IQ. So that's our moderate to moderate range. This is our population that can do the most. They have pretty good, they function in various life areas. You're going to see these students, they are pretty mobile most of the time. They have basic communication. They have pretty good self-care skills. They have pretty good academic, can't spell today, and domestic skills. So at this level, they are pretty good with managing their own bathroom skills. They do pretty good with preparing their own food and bodily functions. Basic is the key word here, with basic. So really good with community and vocational types of jobs. But so we're talking about your sight words. They have a reading level that is at your pretty basic level. You're teaching them at several grade levels below their grade level. They're going to take the alternative assessment. Okay. So if you're thinking about their 35 to 40 to 50 to 55 IQ range. Your severe. This is your between 20 and 25 up to 35 to 40 IQ range. They learn to eat with a fork or spoon. They can dress or bathe with assistance. Assistance here. Sometimes they can use the toilet independently. And they can wash their hands and their face. They usually don't have any academic skills. They might have some sight words. Or know some signs. Like McDonald's. Okay? When you think about your profound, we are talking about below 20 to 25 IQ. I know you're thinking, how did they get that? It's very difficult to get a true IQ for a profound student. They are at the developmental age of below 12 years old. Okay, here's your most severe case. They do have various abilities depending on what they can do. So if you think about, here's your group of students that you're generally going to see at school. Like this is, you're going to have your Down syndrome, your ASD population, your fetal alcohol syndrome students, in your moderate IQ. These are your, what we used to call our students that we really worked with, that could go to our sheltered workshops, that we could really get jobs for, where they learned a skill and they did really well. These are our students that we see a lot at our Special Olympics. We do see a lot of our severe population at the Special Olympics that are doing something, but this is our population that we see there. So I used to see a lot of my my severe population. We had problems with them with feeding. They needed to they needed to be fed. They were in wheelchairs. They needed to have a majority of the things done for them. We did a lot of things for my severe population that were keeping them moving and providing things so that they were didn't have muscle atrophy. It was respite for the parents so that they were not. So they got some time away from them. With my severe population, we worked on trying to get them to acknowledge yes and no. Do you want this? And look over here for yes, look over here for no. To try to give us some sign that they were listening to us. With my profound population, I meant the profound, I'm sorry. With my severe population, we were trying to get them to give us a yes and no, and get them to look, and trying to help them learn to feed themselves and use appropriate tools. With my moderate population, I was getting them to read at specific levels, improve their sight, improve their reading, and to improve their understanding, and use appropriate behaviors. So I mentioned Down syndrome. My Down syndrome students were so adorable. I don't think you can see my pink. I use green. Down syndrome is what we call is the trisomy. I cannot write. Trisomy, I did spell it. 21, because it was with the extra chromosome. They can range from the mild, moderate, and severe ranges. So they usually have language delays. I like to do a lot of language work with them. They have visual memory, better than auditory memory. So they would visually remember things better than what they heard. So because of their language delays, they also had a lot of speech delays or communication delays. So a lot of times they would say things I didn't understand what they were saying. A lot of my Down syndrome students, I didn't understand what they were saying. I had to really listen, and it was the communication. It was more of the articulation issues that they had in talking and the language. So, but they visually remembered things a lot better than what they heard, and a lot of times it had to do with the hearing impairment that they had or the tubes. So many of mine had to have tubes put in their ears. So, and they did become easily frustrated with me, with people, when they would say something and you didn't understand it, and they repeat it, and it was like, really, didn't you hear what I said? Didn't you understand me? So they were easily frustrated with trying to communicate what they were saying. But they're so adorable. And they always seemed or appeared to be very happy, and they were funny. So, but we did a lot of language activities to build up that language delay with them. So, Fragile X is also, it's an inherited genetic syndrome. So, keyword here is inherited genetic syndrome. It's the X-linked chromosome. So, they get it from their mother, and it's from the mother to the child on the X chromosome. So, they have various physical characteristics that will let you know that it's a Fragile X. Disability. They have a lot of health issues. So these students learn best when you present the item as a whole rather than part by part. So a lot of times special ed teachers present things in a little step-by-step process. Don't do that with Fragile X. Present the whole process, present the whole task or the whole topic for your Fragile X students, and then they'll understand it better rather than breaking it up part by part. They will understand it better. And then their weakness is communication. That's their weakness, and social skills. So when you see a Fragile X student having problems, it's because they can't communicate their wants and their needs. And then when this becomes a problem, they have problems with social skills because they're not able to effectively communicate what they're wanting or what they're needing, and that presents a problem behaviorally. So if you really think about it, a lot of our students have problems communicating their wants, their needs, and once that becomes a problem, then their behavior becomes a problem because they're not able to tell people, hey, I was playing with that, I want that, and instead of being able to explain that, they just go and take what they were wanting because they're not able to share, take turns, or explain that that's what I was wanting, or I was playing with that and somebody else came and took it, or they weren't able to ask, can I play with that? So communication, a lot of times, is what leads to our problems with our social skills. And when that social skill communication issue becomes a factor, that's when all of our behavior problems interrupt. And then once the behavior happens, they're not able to explain why the behavior happened. So if you think, when we start trying to understand behaviors with our disabled students, a lot of times it's because they can't explain or communicate to us what happened between them and another student when they were trying to express their want, their desire, their need, and when something else happened. The next one is the one that irritates me the most because it is the most preventable one. FAS, or fetal alcohol syndrome. It is the most preventable one. All you have to do is don't drink. Key word there. If you think you're pregnant, if you think you might be pregnant or you want to be pregnant, don't have a drink. The first trimester is the most important. That is where drinking affects the baby. I mean, all of it. You see abnormal facial, can't spell, abnormal facial distortion in a fetal alcohol child, lower than normal weight, so this child will never be normal weight compared to anybody else. Central nervous system, problems. So you'll see them and they'll always be like moving, and they can't control any kind of body movements. They're always moving, like an ADHD. They just can't sit still, or they've always got some sort of tic. They are very small size. They will never grow, and their hyperactivity. So they are always moving. This one is the one, they have a lot of cognitive disabilities. And it seems like they never seem to catch up. And this one is the most preventable. This is the one that irritates me the most because, as soon as you find out or think you're pregnant, just don't have a drink. It was on the news the other day about bars refusing to give a pregnant woman a drink and how they can't even do that. Well, I think they should. So there are a lot of disabilities outlined in the chapter. I'm not going to go over all of them. So just read about them. So what's important about the Mod Severe room? Learning and teaching. Of course, we can say that's important about every classroom, but language. Language is important about the learning and teaching. So their language is limited for all students. Understanding due to their articulation makes it difficult to understand the students, makes it very difficult to understand the students. And that makes it frustrating for them to be able to understand them, and you always ask them, so what is it that you're trying to say, be patient with them. Try to understand what they're saying, and don't just keep asking them, what are you saying? What are you saying? Help them to slow down and help them to be able to feel comfortable in your class to be able to talk to you. A lot of times we need to help them be comfortable and to understand what's going on. And when they're comfortable, they'll slow down, they'll be able to talk clearer so that we can understand them. A lot of times we're talking so fast that they can't process what we're saying. So just realize that if it's difficult for us, it's difficult for them. When I was talking, I used a lot of pictures. And when I would use pictures, I would use words, I would use writing, I would pair a picture with a written word, I would use a lot of songs, I would use a lot of movement. Using Bloom's, Howard Gardner, and pairing a lot of modalities with my lessons would help them to demonstrate how they knew things. We used movement, songs, art, and language so that they were all involved in using everything possible to demonstrate their knowledge. Now that we have technology, we're so much more advanced than when I was teaching it. Using tools for assistive technology allows them to be able to respond, to give their input, give them a voice that we didn't have before, so that everybody gets a chance to participate. Using a Big Mac switch and having it pre-programmed so that they can hit the button and say, hey, I'm here. And using computers and augmentative communication devices pre-programmed for them to actually participate allows them to be active learners. Picture cards on a ring allows them choice. So if you have a picture card and a picture card and a picture card and they're just ringing together, allows, so if you have a picture of a book or a picture card of a ball and a picture card of a toy, and you ask the student which one do you want a choice of, and they can flip to the picture card of the ball, then that gives the child a choice rather than you making the choice for them. That gives them power to be part of the classroom. And pairing your pictures with words. So if that's a picture of the toy, and that's the picture of the ball, and this is a picture of the book, it helps them associate the picture with the word each time, and they're learning what the picture and the word says. Getting their attention. Have an attention getter with a noise, so that if you need their attention, pair it with a noise. So if you need a bell and you hit this bell every time, that lets them know that, hey, she wants our attention. Or if you have a noisemaker or some sort of other loud noise, that lets them know, oh, I need to stop and look at you. So they really do have something that will get their attention. If you need a flashing noise, a flashing light, use a flashing light. It'll work. Something that's unique. And so with Mod Severe, their memory is like 50 first dates. You work on it and 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 you think, oh my gosh, they're never going to get it. But it could be that you work on it today and tomorrow they remember it. So just remember that each time you work on it, their brain stores it. And then it stores it again, it stores it again. Finally, you're going to look at it and go, they got it. So don't give up. They need to learn that what they are learning applies. This is called skill synthesis. Each time you work on it, that what you're doing applies to another place, applies. Everything that you learn will apply and transfer somewhere else. So don't forget. And that it will generalize. So what you're learning in this class will generalize and go to this class as well. So that's another part of learning, is that they have to learn that everything you do isn't just for in here, it applies everywhere. It goes to show with everything that you're learning. And I believe that's all I want to say. Yep. So thank you. I hope this helps. And